clutter there? Was the patient looking at it? So what's the patient's answer going to be when asked that question? Was the room always kept clean? They could say yes, because they have a consistent person coming in and cleaning, but they can also say no, because was the room always clean? No, it wasn't. Someone does come often and remove the clutter and straighten it up, but always is always, Liz?
Dion, I think Dion, Marcos, I think it's a very interesting question. And, I'm split. I'm 50-50. I feel it's so important to always maintain the cleanliness and comfort of a patient's room, a patient's environment, whether it's the emergency room, radiology, inpatient or outpatient. I feel it's so important, and I know we all do. And it's one of the reasons why Dion and I were going back and forth with what to name this podcast. And we said clean and comfort. Dion said it has to be clean and comfort, because our patients' cleanliness and being comfortable when they're with us is so important. So I'm trying to, I'm trying to agree with both of you. But I really think the question we have to ask ourselves as leaders are we or have we started to use the HCAP survey to validate our cleanliness and infection control? And if we are doing that, we should not be doing that. We should be our leaders, the leaders of environmental services, and our frontline team members should be the ones to ensure the cleanliness, the comfort, and ensure that we are using the best practices to ensure infection control. And I think it is so important, to make sure surfaces across the environment are clean and that we don't contribute to healthcare associated infections. And I think that I really believe that if we're using the HCAP survey, which many hospitals do, we ourselves, we call each other up, we compare, where are you at this week or this month? Where are you? Where were you last year? How many points are you looking to raise your score? I mean, we're very competitive with it, and you guys know I that number so often, but I also go out and I make rounds. I build relationships. We coach. I know I've seen the both of you rounding so often on patients, on staff, on patient care directors and nurse managers. But I think that if hospitals and other environmental service professionals are using the HCAP survey to validate cleanliness, the comfort of a patient, the care of a patient, and infection control, it's the wrong measurement.
I agree. I agree. I don't think that survey should be correlated with what you just mentioned. We should have our own measurement to validate clean and comfort.
Yeah. So if CMS is collecting this data, maybe, I think it's important to make sure a patient, I really want to emphasize this. It's so important to make sure every single patient in our hospital feels safe, cared for, responded to, and hopefully feels better when they leave us emotionally and physically than when they entered our building. I know we all want that.
Yeah.
Yes.
But if CMS is using this question, I think that they need to rethink and relook at the data that they collect, because we are all doing ATP, which Dion, I know you've mentioned that ATP just tells you, is there any bioburden or residue or anything on a surface? It doesn't necessarily tell you what's there and how much of it.
Correct.
And you know, and I know that other hospitals use and validate cleaning through the fluorescent marking. And then others use validation through physical inspection and direct observation. And we do all of those combined to validate cleaning.
So good point. Now we're in COVID. We're in COVID. So and this is why my original thought with validation, with swabbing and sending the swab out to be tested, to validate that the products we're using, the processes we're using are the right ones, to make sure that nothing is transferred between patients or anyone else. And I think if you're in a hospital setting, that's the approach we need to take. We should not take any other approach but that approach. We can add to it, but that should be one of the main approaches that we take to ensure that the products we're using and the processes we're using are the correct ones.
Yes, I agree. The industry as a whole needs to take a look at the process for validating and ensuring that the healthcare environmental services are disinfected and meet the standard for being considered clean.
Clean, correct.
And you know, there's three levels of disinfection, right, or cleanliness. So you have sanitation, disinfection, and sterilization.
Correct.
And environmental services, we practice disinfection, and we use low to medium or intermediate level disinfectants. And I think that if the industry can come up with, and we have so many resources and so many vendors and so many really incredibly intelligent, smart people that could take a look at a way to validate what's on the surface and is it clean enough and disinfected enough for the next patient. Someone really needs to work toward a validation process that's immediate, where you get results in live time. And I don't know if that exists yet, but maybe we should invite some of our vendors to, and during our upcoming podcast, to discuss the many different ways to validate the cleanliness of surfaces.
Right. Yeah, and I think all that ties in a little bit with being able to give the staff, the frontline staff, that confidence that what they're using or what they are doing every day is effective and is giving them that the sense of security, because right now that's what's missing in a little bit, and it's going to create a little challenge when it's time for us to really get into the resolving or improving these HCAHPS scores. As a lot of my staff from frontline firsthand experience is that they're reluctant at first. Is this patient positive, negative? How do we know if this room is thoroughly cleaned? Those are the types of questions that come up. And like you mentioned, with knowing real time maybe or some way of certifying that these products or these ways of disinfecting and sterilizing is working, I think that'll help that make it a lot easier.
And validation would help with that a great deal, because if we know that the products and the processes are working, then that takes so much off the table.
Yeah, definitely.
We cannot continue to guess. This is a different world. We have COVID now, and we have other things. We have Ebola. We have all kinds of things going on. And we have to make sure that the processes and products we're using are the right ones. And Liz, you mentioned that our steps are considered intermediate. I'm not sure if it is, because as you can see, if the products we're using is actually killing COVID,
it's final.
I think it's a step up from what others are doing. And the processes we used to do it one way, and we totally changed our processes, and it
one of the reasons
working. Yes.
One of the reasons why we really took a deep dive into our processes and our training was because we realized we had variation in our process.
Right.
And any level of variation it's hard to validate the effectiveness of a program if you have many people doing things differently. Correct. So we identified that at a system level, and we worked to ensure that we were standardized our processes. And, we were successful in doing that, but and we know that we have to go back and we have to continue to evaluate, continue to evolve and change our processes to ensure that we're using the latest and greatest technology. And I know we could do an entire podcast on the different technology that enhances the disinfection process. And there's a lot of technology out there. There's a lot of discussion and data about using UV light, UV disinfecting. There's a whole different ways now, and I'm sure a lot of other ways coming where environmental services and healthcare facilities can enhance their cleaning. But nothing, and we talk about this a lot, nothing can physically, that we know of yet, can physically remove soil and dirt from surfaces and replace somebody's physical, mechanical action of cleaning. Absolutely. And some of those other things are enhancements to make sure you don't miss anything and to really ensure that the surfaces are free of any bacteria, germs, and bioburden. But it really comes down to what really matters, and that is our frontline team members with the proper tools, proper processes, and support and leadership to make sure that they feel comfortable, confident, and safe in doing their work.
So now the patient knows that the products we're using is effective. The housekeeper knows that the product they're using is effective. The patient sees the housekeeper working diligently daily in their room. How will the patient feel? I think, the patient will feel good and feel safe and would choose our hospitals to come back to at any time because of this. So I know this has been a great discussion. Thank you guys for joining. Liz, we'll talk again next week. Marco, hope you can join us again. Liz, anything else to add? And Marco?
On my end, I definitely am very grateful for taking this time to be able to discuss. With COVID, it's been very hard to create these kinds of meetings, obviously. But so this kind of platform has, gotten me again all excited and all enthusiastic about what lies ahead. So hopefully with like I mentioned before, with what happened with COVID, we can all learn from each other and maybe work on with improved ideas for the future.
Yes, Liz.
Well, I think just a really huge thank you and appreciation to every single environmental services frontline professional healthcare worker in America and everywhere, because the last 3 months have been incredibly challenging. Marco said it before, that this was such an unwanted team building exercise if we have ever seen one.
Yes.
The way that everybody worked together and cared for one another throughout New York City and every other town, city, country throughout the US is just simply amazing. And when you take the time to process everything and think about what our teams have been through, what other teams have been through, just really a huge thank you. What a courageous and valiant effort amongst these environmental service employees that we are so privileged to lead every single day. Just amazing.
One thing we wanted to do, Liz and I wanted to take an opportunity, and this is the opportunity, to thank everyone for